All right, so here our focus is going to be looking at psychological disorders. So just to introduce, and again, I think a good way, as has been kind of an approach with this course the entire semester, is to look at the different conditions that we're going to be talking about, in categories. And again, this holds true here. So we're going to be looking at various psychological issues as they relate to, certain categories. So for instance, substance abuse, we're going to be looking at substance abuse with both prescription and illegal drugs. Eating disorders and disordered eating, and kind of look at the spectrum there, obviously focusing on things like anorexia, bulimia. Mood disorders, so things that would fall under mood disorders would be things like depression, bipolar, seasonal affective disorder. Anxiety disorders, different phobias, panic disorders, post-traumatic stress. Somatoform disorders that look at things like somatization, malingering, conversion disorders. Personality disorders, so things like antisocial behavior, borderline personality. Psychoses, so for instance, there we'll look at things like schizophrenia. And then with pediatric issues, we're going to particularly look at child abuse. So obviously, as any healthcare professional, you need to be able to, particularly when you're working with young kids, you have to be able to recognize potential child abuse and report if you feel that it's taking place. So if we look at the signs and symptoms as it relates to various psychological conditions, and again, these will kind of fall into these various conditions as we talk about them. You look at an individual's sleep patterns. Are they sleeping more? Are they sleeping less? I mean, it can be affected both ways. You look at cognitive status and cognitive function. So, for instance, are they having increased passivity or increased aggressiveness? Are they having memory problems? Are there attention issues? Are they disorientated? Are they having difficulty focusing on tasks? These are all things that, come about as a result of various psychological conditions. Look at weight loss and appetite. And again, we'll see some of that with some of the eating disorders, but there's other psychological conditions not involving eating disorders that would have that as well. Emotional ability and changes in mood. Are we talking about a person who has a significant change just kind of in how their moods are, or are they kind of all over the place, one minute being ultra happy, the next minute being sad. Any inexplicable or bizarre symptoms. So again, there's a lot of things that can be kind of lumped into that. So you look for things that just kind of don't seem to go along with a person's normal pattern of behavior. Should be noted as well. Again, there's specific tables in the text. Again, when we look at a lot of different signs and symptoms, so these would be different categories we'd be looking at. So certainly, again, the text has some very good visual tables that will kind of outline this. So pay attention to those as you're going through the reading if you haven't already done so. But again, different behavioral signs of substance abuse, intoxication, overdose, withdrawal, talk about some of the different things that go along with those. Eating disorders, and in particular, the increased risk of suicide. So, things that would possibly head in that direction as far as suicide would be concerned. As far as the exam, again, personal and family history would be an important thing to look at. Ask about as well any type of medications that the person might be on. Again, a lot of times the medications, or if they're already on meds, psych meds, they could certainly affect physical activity as well. So that would be important to note. Again, as a part of the physical exam, kind of note the individual's behavior as a part of that. Some of the physical exam findings might be kind of a little inconsistent when you're dealing with a psychological disorder. So again, their behavior is probably the best kind of indicator. And again, people with significant mental, emotional impairments can behave erratically and can be doing various things that would be outwardly abnormal as far as just behavior is concerned. So that's really probably the biggest thing to be looking at there. And then a mental status examination. So again, you want to look at judgment, orientation, cognition, and memory. Again, just an example, there's your textbook gives some examples of mental status questions that you would basically look at, and then what would be, kind of acceptable or what we would consider normal answers. So obviously with like orientation, person, place, and time, can they do that? You could ask judgment questions. Your textbook gives the example: if you found a wallet in the lobby of an office building, what should you do with it? The logical answer would be, turn it into security, or just any other logical answer. And again, all you're looking for there is just to see, like, are they answering at least, not that there's necessarily one correct answer, but are they giving at least a normal answer to your question that would seem that would be, normal for most individuals.